Hi, we are starting today's live section. Gana, hi. Yes, hi, mom. Hi, dear. Actually, welcome to Nursing Manthra platform. My name is Shinsi George. Professionally, I am a registered nurse and currently doing PhD in nursing. Nursing Manthra is a platform which is here to assist all the healthcare professionals. Doctors, nurses, then paramedical professionals, TCAM professionals. We are assisting all healthcare professionals documentation services for Gulf countries and European countries. So it is a basically it is a document clearing agency. Nursing Manthra is a document clearing agency. Okay. So for European countries and Gulf countries. For those who are new to this live chat, just explaining. Okay. So apart from that, we are providing the study materials for various healthcare professionals, Prometric materials, then NCLEX-RN study materials, and all data flow services, exam bookings, licensing process, everything we are doing. Okay, NCLEX-RN application process and all we are doing here. So even our guidance, if you have any queries, then our guidance in WhatsApp, it is free also. Free of cost, we will advise you based on our experience. We are advising you how to proceed with the each processing. Okay, that is free of cost. Hi mom, good afternoon. Good afternoon. Hi mom, good afternoon. For everyone, it is good. Hi mom, I have DHA license for registered nurse. Is there any vacancy for Dubai? Yes, related to that, I will discuss later. Now, actually, this live session, it is for mainly for data flow, the issues facing in the data flow verifications. It is related to that. So here for the live session, I am planning to conduct the live session every Saturday 2 p.m. to 3 p.m. Indian time. Okay, with the various different topics every Saturday. With the different topics, we will do the live sessions. So you can suggest the topic to discuss, and most preferred topics will be select for the next coming Saturdays, and we will discuss on that. So I think some members are there. We can move with the today's live session content, that is data flow verification related issues and what is the solution we have to do. Farouk, hello ma'am, my wife is midwife nurse in need nursing job for you, help me. Regarding the nursing job vacancies, we are posting in our channels, so you can just go through the Nursing Manthra website, and even YouTube channel also we are updating the nursing job post which we have. Just 1 second. So what is data flow? Data flow means it is a primary source verification of the documents. It is doing by outside agency. Data flow is mainly doing for Gulf countries to check the authenticity of the documents which is provided by the candidates. So each healthcare authorities, they are tie up with the data flow to check the applicants' documents whether it is correct or not. Okay, so to get license to practice in your profession, okay, healthcare profession, you must have the data flow report. So how the data flow verification is going on, that means once we upload the data flow documents and we are making the payment for the data flow, within 24 hours, if any problem is there, means within 24 hours we can cancel that data flow application, and your money also will be refunded. After 24 hours it is not possible, you will not get money refund also, if by mistake if you have done some wrong submission and all. Okay, so they will start the verification after the payment. Data flow team, they will start the verifications Usually they will send the mail to the authorities, your education authority, licensing authority, employment authority. They will send the mail. If there is a official web mail is there, means it is better. Even Gmail also they are sending. They will send initially the mail related to the your document, whether it is genuine or not. They will check it. Later on, if the mail replies too late, then usually they will call also. They will call and ask. Sometimes they will do the site visit also, for especially for the employment certificate and all. They will do the site visit. So like that they are finding out the reply from your employer side and your other education authorities, licensing authorities. They are finding out whether the document is genuine or not. Okay, so today's live session I prefer to talk about what all the things we have to take care while we are applying for the data flow. So unfortunately, if your report comes negative, what is the solution for that? So you know that once your data flow report comes negative in any authority, suppose if your data flow report in Qatar in 2015, if it is negative, and now currently if you are doing for the data flow for the DHA, suppose the data flow report come positive with the latest reports, you are like documents you are doing data flow, and that report comes positive, means you will think that it is okay, fine, everything is fine, I got a positive report, like that. But the problem is when you are applying for eligibility, that time DHA they will identify your previous negative data flow, and they will say that okay, you have previous negative data flow in Qatar in 2015, you have to clear that one. After that only we can provide you the eligibility, like that. So it is like I think it is maybe artificial intelligence system. It is linked with that, easily identifying the candidates details. Because I assume that some details they will enter, like your educational details, they will enter in their data flow system, so the data flow team can easily identify, so they can easily identify if any problem, if again you are submitting the same educational document, like that easily they can trace out. Even though if you are changing the passport, your name, surname changes also, they can easily identify. They will identify that the educational document submitted by you, the degree certificate, in that the name will be, same name will be there. Okay, and again next time maybe after 5 years you are submitting for the data flow again, that time also your educational certificate name there is not changes. Okay, certification registration number and your name details, date of birth, like that. Or nowadays AI system, it is easily identifies. So maximum avoid the negative data flows, because lifelong you will be banned if you have the negative data flow. For the Gulf countries, you cannot apply anywhere. If you have negative data flow in Saudi, you cannot apply in UAE or Oman. Everywhere it's not allowed, because automatically the negative report from one authority is getting linked with the new report. So there is no it's your life completely in, you will be in struggle if you have the negative report. So here, okay, Farouk Sohail, I am Pakistani, in need midwife nurse. You send me data. Office of my name is Yasmin, midwife nurse. Need job, any one country. Regarding the job details, on the job session videos when I am doing, that time we can discuss. Okay, now we are discussing related to the data flow negative issues. Okay, PSB verification, your document clearance related issues. Today's topic we are discussing. When we are coming with the job details, separate we will do. Okay, separate live sessions we will do, how to find out a job in each countries. That time we can discuss on that. Okay, then regarding to our topic, like educational document, okay, we will discuss each and everything in the data flow, which all are the component is there. First of all, the important thing is you have to make sure that you have all the documents perfectly. Okay, like your educational document, license, if it, whether it is renewed or not, valid license should be there. Okay, then you must have the good some authorities, they will ask for good standing certificate from the licensing council. Some countries they will like it is a good standing, we can skip also. Then we have to submit the employment certificate. Then for doctors and all, internship certificate it is required. Specialist means in the DOH and all, residencies training certificate is required. Okay, like that. So each according to your profession, the change for the data flow, which all the components we have to submit, that differs. But most of the professions, it is compulsory that education, license and experience is mandatory. So regarding educational component, what is the issue we are facing? So many data flow reports are there with a negative education. Why it is like that means, so you have to make sure that your education authority is not blacklisted. So I have made a video regarding unaffiliated paramedical courses in India. Okay, you can go and watch those who are from India, those who have done paramedical courses from India. You can check for the blacklisted authorities for education. Then in so many states in India, they don't have the paramedical councils. State paramedical councils are not there. Because of that, the problem is the candidate will not know whether their education authority is approved or not. For nurses, there is nursing council is there. So nursing council permission is required for the college to conduct the nursing studies. INC it is required. So all will check whether it is approved or not, like that. After that only most of them will join. Otherwise they will not get the nursing council license. Same like for doctors, there is medical council is there. Dentist, there is dental council is there. But unfortunately paramedical council, like a pharmacy, there is pharmacy council is there, but lab technicians, then CSD technicians, OT technicians, anesthesia technician, like that, all paramedical categories, the problem is there is all the paramedical members, they don't have the councils. Tamil Nadu, they don't have a strict paramedical council, not there. So those who studied from Tamil Nadu, they have to register the paramedical council from Delhi and all, like that. Kerala, there is Kerala State Paramedical Council is there. So if you are joining in Kerala, you can check with the Kerala Paramedical Council whether the course is valid or not, like that, and you will get the registration in the paramedical council or not, that you have to check. Like that we can identify. Other than that, if we are giving the data flow to a trusted agency, those who have more experience and those who knows that which are the universities and authorities blacklisted by through their expert, you can approach them also. They will be having experience and they can identify whether the certificate is okay or not. So what will happen means, if you submit that blacklisted certificates, now example says that like a Bharat Seva Samaj certificate, a skill development council certificate, human resources society, like that, so many certificates are there which is not valid. I think around 60 to 70 around list is there with me. Too many it is there. Okay, so that is related to the education blacklist, it is coming. Okay, so whether the university is approved, how you have to check means University Grant Commission, UGC approval. Especially I am talking about Indians. Okay, so many states are there in India, each state having different rules are there. So for Indians, you can see UGC, University Grant Commission. Under that you can check whether your university details are there or not. So in the UGC it is mentioned blacklisted universities details also they have given. Okay, and the approved universities, in approved university which all are the courses are approved there, that also mentioned. Okay, make sure before submitting to the data flow your education authority is positive, that you have to make sure. Okay, then that is one is UGC, you have to check for the University Grant Commission site, you have to check for the whether it is approved or not, you can check. Secondly, you can check with the state paramedical council. You can contact them and ask whether this certificate is approved or not, because unfortunately some states they don't have state paramedical councils working efficiently. So for those I cannot help you, but whatever I know I can help you when you contact us through Nursing Manthra. And the second problem is for the education, that is distance education. Nowadays too many applications which I am getting the queries related to the distance education. Candidate is studying in their particular state. Suppose a girl from Kerala, she is studying in Kerala, reputed hospitals in Kerala, the big like NABH hospitals and all in Kerala, they are studying there, okay? But their degree issuing is from Rajasthan, NIMS University, suppose example, okay? Degree issuing from other state, and they are studying the college in different state, like that, okay? Different state if you are studying and the degree certificate is from another state, what will happen means, when the Dataflow team approaches the registrar will say that this is distance education. Like that, so many incidents happened. That also, what will happen means the Dataflow report will come positive, like, and mode of study they will verify it as distance education. So in that there is problem, okay? Distance education, there is problem is there, because all the Gulf countries, they need regular course of study. They will not accept the distance education. Only regular course they need. Okay, that is the thing. So unaffiliated the authorities and distance education, these two things are the main problem. So if you have your sisters or family friends, anyone is studying, going to study any paramedical course, they must check the UGC site. Even diploma courses also means they can check with the paramedical councils, state paramedical councils. Okay, after that only they can join. Then make sure that you are studying in the same state. If you are going in a college in Karnataka, you must get the degree certificate or diploma certificate from Karnataka, not from north side. Okay, same like that for all state you have to follow. That is important thing. Then in that also you will get, even though you are going in a college regular basis and doing all the assignments, exams, everything you have done perfectly, also your degree is issuing from different state, mostly it is coming as distance education. So it is not valid. Even for abroad, anywhere it will come like distance education. It will be a big problem. So the course selection is very important. Then next is our license component. Next, in the Dataflow, there is license component is there. Normally in the license component negative, I am not saying that much. If the certificate like a candidate make a fake certificate, it comes negative, of course. Otherwise, usually what is the issue happening means unable to verify report comes. Unable to verify report, why it is coming means our renewal certificate, okay? License renewal certificate we have to submit. We have to submit license renewal. That means if Karnataka Nursing Council license if you have, and it is written like a permanent, like that it is mentioned, lifetime validity, like that mentioned. But nowadays that rule, everything is changed, and we have to renew every 5 years, okay? That one we have to do the renewal. If we are failing to submit the renewed copy, Dataflow report will come unable to verify for the license component. Then I can see that in some Nigeria, Ghana, like that and all, there the Dataflow licensing authorities, they are responding that a certificate is not good, like that, and all means negative reports it comes there also. But mostly license I can see unable to verify report because not submitting the renewal certificate, okay, license renewal copy. Before applying for the Dataflow, you must make sure that you are submitting the renewed copy and your license is valid. That is related to the license component. Next, which one is means the employment component. That is very important thing, okay? So the most important topic in today's session, that is employment discrepancy. So what are the ways to get scenarios which comes for employment discrepancy. First scenario is a facility closure. Okay, that means the hospital where you worked, the hospital is closed, and or your clinic is closed, and now no one is there to respond. In that case, you will get a negative or unable to verify a report in the data flow, and you cannot proceed with any licensing in Gulf countries. Only the option we can apply, that later I will say. Okay, so that is one scenario, that is facility closure. Okay, so before applying for data flow, you must make sure that your employer is still functioning. Okay, even though if it is 5 years back employment certificate also, you must make sure that your employer is still functioning, and get the official HR email ID and phone number. Okay, that you have to get before applying for the data flow. That is the thing. Okay, then other important thing is bank transaction details. So whenever you are joining for a job, you must make sure that your salary is depositing into the bank account. So even though if some cases, if you have the PF statement and bank transaction details, with that we can apply for mercy appeal and all we can provide. Okay, if it is they can see that it is okay, really she worked there, like that they can feel it, and they can approve also. Sometimes I have get so many times I got the approval in that way. But that's why make sure that you have the bank salary transaction. I know that still there are so many hospitals and clinics, they are not providing salary through the bank account. Okay, they are still giving through the hand. So for the make sure that you are requesting with the employer to provide the salary through bank. That is important thing. Okay, that is one first scenario. Because of the hospital or the facility it is closed, because of that employment comes unable to verify, or discrepancy also. If again re-verification we are sending, it will come discrepancy, negative it will come, and there is no option and no authorities accepting also. Then next thing, poor management system. Next scenario we can see that poor management system, in that you are breaking the you are breaking the contract, then management is not good with you, and they are not providing the experience certificate because they don't want to leave you from their place. Okay, like that cases, don't submit any still working certificate which is issued for any other purpose. Like I can see that most of the candidates will provide the still working experience which is issued for bank purpose. They will say that it is for bank purpose, and they will take the still working certificate. What will happen means, here when the data flow team approaches your employer says this is not for the data flow verification, it is just given for bank purpose, so this document is not genuine, like that they will mention, and you will get negative report there also. So if you are submitting any document, and the problem is maybe without knowing you are submitted, but your data flow report comes negative, means lifelong it will be there. You cannot move to any Gulf countries without making the data flow positive. Okay, so it is very important thing. Then so in this case, make sure that you are informing your employer that you are going to apply for data flow verification, and when the data flow team mails them, they have to respond back, like that you have to inform to your HR department. Always in your workplace, don't make so much of issues, troubles and all. Okay, be happy, and with the management and all, good relationship you have to maintain. Okay, because lifelong we need them for even if you are going for European countries later on, so many things. Okay, come lifelong you must need them when you are practicing professionally. So don't make any jagada with them. Okay, then other thing, third scenario means we are applying with the fake certificates. Okay, so it is not good practice to make the fake certificate. There are so many we can give the excuses for making the fake certificate to meet the gap of practice. So most of they knows, the authorities knows that due to some personal issues there will be gap. They will give the permission for until 5-year gap. Okay, so 5 year, until 5 year there is CM gap is there, means a CME training program is there, like a Qatar or UAE, DHA, everywhere it is CME training program is there. It will cost a lot, so but they are giving that option. When they are giving that option, if we are making fake certificate and keeping, and they found that it is a blacklisted hospital, it is fake, then there is no excuse, we cannot give any solution for that. Then other important thing, the scenario for the scenario is the blacklisted hospitals. We don't know which all are the hospitals are blacklisted. So if you are really working in a hospital and that hospital is blacklisted also, and they says that you worked okay, this all document is genuine, if they says like that also, your report will come negative. So what you will do? Only the proof you can show your PF statement and the salary transaction details during that experience duration. That's why I'm saying it is important that you must keep your salary transaction details and the PF statement. If PF is not there also, you must request with the employer to provide the PF statement. We don't know when the hospital will become blacklisted. Okay, especially the small hospitals. Big hospitals and all, usually they will not issue any fake certificates and all, but small hospitals, there is a chance to come like a blacklisted. So you must be careful. We don't know where we are working that hospital. They will provide so many certificates to different persons and it comes negative, we don't know. So always from you, for your safety, even if you are working members also, your safety, you have to keep the bank salary transaction details. That is very important. Okay, that is the thing for then so here what is the solution if some of you got the negative data flow? What is the solution for that? So for them, anyway, we can try. Okay, Nursing Manthra can try by applying for the re-verification. We will go through the document and closely we will monitor all the things. If there is any loopholes, we can clear it out, okay, or we can provide the mercy appeal to the authorities. Like that, maximum we will support you to assist you for making to clear to get a good professional license. Okay, so if anyone is getting data flow issues, then we will try. Okay, we will try to apply for the re-verification and all, and to make it positive. You can contact Nursing Manthra WhatsApp for any assistance related to the data flow, any data flow issues, unable to verify, discrepancy, just you can just as a guidance you can take. Okay, some members there is no solution, but some members there will be solution with they don't know what to do. In that case, how we can manage, we can guide you for that. So now if you have any doubt related to the data flow issues and further things, you can just ask here. So our subject is finished. Now if you are if any one of you have trouble with the data flow issues and all, you can just message related to that. Okay. I want to go to Dubai, how to go? Shakil Mia, that's related to the different topic. I have done the video related to the DHA licensing process. You can watch that DHA licensing process video. You will understand all the details clearly. I got Dataflow discrepancy in DHA. I wrote MOH, but still no job. It is possible again DHA, any system change DHA. It's not possible to in the DHA, because in the DHA your Dataflow report, it is already linked, and it will be saved there, dear. You will get a job. It's nobody is coming back. That is the real situation. Those who are searching for the job, they will find out, but you have to struggle a lot to find out, and you have to improve yourself to with a good communication skills, and you have to impress the interviewers, like that. Okay, you will get even a small clinic also, you can find a job. Initially you can start your career there, later on you can change it to the hospital. Not only the I need the hospital, like that, don't think. Even small clinic also you can move. My friend got negative report last year, Saudi Commission. Now she is planning to go to Dubai Health Authority. So the Dubai Health Authority, she cannot go, Sham Kumar, because Saudi report that will be attached in the DHA. So DHA system, they will identify the Saudi negative report. So it is not possible. If there is any other way, we will just you can ask your friend to contact us in our WhatsApp number. We will just go through the report due to what is the exact issue, whether we can clear it out with the re-verification. We will check. AA health creation. If Dataflow got a discrepancy, what I have to do? It depends on the Dataflow report, whether it is education component or license component, employment component. What is the content in that? Why it came negative? Based on that only, there is a solution. If it is there also, we have a solution based on that. Vijay Praveen, CMI. Yes, Vijay, CMI certificate also, it is not up. Diploma courses under Christian Medical Association of India. We know that it is in Vellore, a big institute, but the diploma courses from there, it is not valid. Degree is valid, but diploma courses, it is not valid. Tesna Singh Rai, DHA exam pattern change or no? Exam pattern, it is recently there is no changes are not there, because candidates not mentioned regarding changes after we given the materials and all. It's all are getting passed. My wife has a problem in Dataflow MOH. She passed and verification for experience certificate not done. Hi Prince, you can just contact us through the Nursing Manthra WhatsApp, so that we will review the documents and give the guidance. Okay. Resna Singh, hello mom. Hi Resna. Rubina Shamir, I am BSc MLT. I completed my course in Rajiv Gandhi University, Karnataka. Yesterday I took registration from one website, Indian Paramedical Council, branch office Nagarkoil. Is it fake? Nagarkoil Paramedical Council, I am not sure, but Paramedical Council of India, Delhi branch, usually it comes positive for the Dataflow. I can see that. Okay. Like Kolkata Paramedical previously, so many West Bengal Paramedical Council and all negative I have seen before. So I think better Paramedical Council of India Delhi branch, you can apply. That will be better, I think. Vijay Praveen, any vacancy in Oman for radiographer? Vijay, if we have the vacancy, we will post in the groups, like in the YouTube and website. We will mention the job vacancy list. You can go through www.nursingmanthra.com. All our service details has mentioned there, job vacancies mentioned there, blogs, different blogs are there related to each country licensing process. Okay, so each country, like USA, so many boards are there, nursing boards. Each nursing board, what is the process, how you have to, what are the documents required, how much fees it will be, all the details mentioned. Canada processing, Canada different province we have mentioned, like that. All details are there in blog www.nursingmanthra.com. Okay, you can go and check there. Even job vacancies mentioned there. Regarding study materials details also mentioned there. Everything you can find out in the website. I have Dataflow negative report. What will be do? Please help me. Hi, you can just contact us through Nursing Manthra WhatsApp number. Actually, you didn't mention the reason here. Because of that, I need to review your report. If there is any possibility, we can apply for appeal process and all. I will just go through. If not, anyway, whatever the solution, I will inform you. Winnie Benny Ambrose. Good afternoon, Ma'am. Josephine, is there any vacant for Dubai in female nurses? Female nurse, Dubai vacancies we have listed in the job vacancy list. Like you can just in that job code will be mentioning. You can just mention the job code and you can post in the job vacancy details. Okay. So how we have to do it is mentioned in the website. You can go through that. Farooq, hello ma'am, my wife is midwife nurse. I need actually for the midwives there is vacancies are there in the hospitals. Okay, very rare to get the midwives. It's a registered midwife. Vacancies will be there in the labor room. Vacancies previously, and some employees asked me whether you have the midwife. At that time, I don't have anyone who passed the DHA. So like who had the eligibility letter, I don't have anyone. I even made a like a job request poster also, even though I didn't find out any midwife. So assistant midwife they don't want, they need a registered midwife. A bachelor degree in midwifery, for them there is still vacancy, I can assume. Hi mom, I have DHA license for registered nurse. If there are any vacancy, most of the vacancies is now I am getting that is from a clinics, the medical centers, home care clinics and all. Salary almost same, like 3.5 to 4 like that I am getting. But I can see that candidates are not interested for clinic jobs and all. Most of them they are as like a home care clinic. Home care clinic means no need to go to the home care, like that continuously. You will not be there in the home and all. Whenever you are getting a call to take a sample or for some dressing and all, that time you have to go from the clinic to the home. Only that is the home care jobs and all. So like that jobs vacancy still it is there. Some employees are asking for that. Other than that, hospital vacancies it is there in under DHA the hospital vacancies it says, and industrial nurses also. If anyone is having endoscopy like that, endoscopy and emergency department. Endoscopy nurse, one nurse is required actually in Dubai under DHA hospital side. Then good afternoon, hi my dear. Mom, can you please explain about Shyam's question? What is that? I didn't understand. A health creation, what is that question? I didn't understand. Then I have DHA eligibility letter. Any vacancy for me that regarding job vacancy, I was saying regarding that. Soumya, I am a dental assistant nurse vacancy. I have completed DHA eligibility for dental assistant. Dental assistant, still you can search there. Previously, last month, we have already given to the employees so many dental assistant contacts. Now, currently, there is no vacancies not there. Greetings. Is there any role for midwife trained for 3 with the diploma in midwifery? Assistant midwifery category we will get for the midwife, those who completed 3 years. But in the hospitals, they can take them also. I think there are a lot of assistant midwives already there. Most of the hospitals, they are asking for registered midwives. That is the thing, okay? Is there any doubt related to any documentation clearance? You can just message here. So every Saturday we are conducting the live sessions. Okay, Saturday 2 p.m. to 3 p.m. Indian time. So those who are watching now, if you have any topic suggestions, you can provide the topic suggestions as comment. So maximum topics which comes, that one we will select. Okay. And after this live sessions, this video will be posted. So the content which we have discussed, that will be saved. So for anyone, those who are coming late, you can watch the video. You will see the content which today's live sessions details. And now if anyone is having doubt, you can just send the message related to any document clearance, Gulf countries and European countries. I think there is no comment, so I can close the sessions. Closely, hi mom. So our nursingmanthra.com website you can watch, and if you have any doubt or any queries, you can contact our WhatsApp number +971 5025 Okay, even if when you are logging to the website, there is WhatsApp icon is there. When you are clicking on that, directly it will be leading to the details. Nisha, I am BSc Cardiovascular Technology graduate. How to get a job in Europe and American countries, mom? Okay, Nisha, you can contact Nursing Manthra WhatsApp number. We will guide you, okay, based on your preference, which country. In America, we have 50 state boards. Boards are there, so under which each board having different rules, regulations, and document clearance different references there. So based on that, we can select. Okay. I completed physiotherapist. I have 1.5 years. I work in abroad. SVG. Yeah. I didn't get your query actually. Do you have any office in Abu Dhabi? We have office in Dubai, not in Abu Dhabi. But you can just contact Nursing Manthra WhatsApp if you have any queries related to that. Okay. So today's topic was data flow, negative data flow reports or discrepancy in the data flow. If you have any friends, those who are facing issue with the negative data flow and all, you can just give Nursing Manthra reference. We can just go through that documents details, and if somehow can manage with the re-verification with the data flow and all, we can see. Okay, you can just inform the details to them. So you can ask them to contact Nursing Manthra. So if you need any assistance for document clearance, European countries, then Gulf countries, places, Abu Dhabi, like then Qatar, Bahrain, Saudi, Kuwait, all Gulf countries, then Australia, New Zealand, Ireland, Canada, USA, most of the state boards of nursing in the USA, and Canada, most of the province also, we are doing the paper clearance, okay, document clearance we are doing. If any of you, those who are watching, any of you need any document clearance assistance, you can contact Nursing Manthra. After 2 years, we can apply with the no certificate. I have old native report. uh, after 2 year, if you are submitting with a new certificate, okay, I understood. In the negative, if you have a negative data flow report, like after 2 year, if you are submitting with a new experience certificate, don't think you will get a license. Okay, because your new certificate data flow, that will come positive, there is no problem for that. But your old report, old data flow report, it will get attached with the new data flow report. Sometimes without attachment also we can see the positive report only, but when we apply for the DHA authority or any authority, they can easily trace out the previous data flow report and you will not get the eligibility. Okay, that is the thing going to happen in your case. So here job portal links you can see in the comments. Those who asked for the jobs, you can just register there in the Nursing Manthra job portal. So there is a link is given here. You can just click on that and fill all the details. So whenever we have a vacancy, we will check for your job is matching with your profile, then we will send your resume to the employers, and if they like you, they will select. Okay, apart from that, there is no fees and nothing is there. So make sure that your CV is good enough to attract the employees. I completed physiotherapist. I have 1.5 years. I am eligible to work in Dubai. At least you complete 6 more months, okay, 7 more months, maximum make 2 years completion. So after 2 year, anywhere we can apply. There is no problem. Just complete that certificate, okay, experience certificate of 2 year, then we can work. In Dubai, eligibility we will get for freshers, that is for the nursing, then for the lab technicians. Okay, apart from that, most of the professions they need experience. So here a physiotherapist 2 year experience you can submit. But like a beauty therapist, so many other minor like lab paramedical members are there, that is 1 year experience is enough. Like that case is also there. I think I have covered all the messages reply. So every Saturday 2 to 3 p.m. we will be in live. So if you have any doubts related to anything, and if you want to make a video related to any particular topic, that topic also you can mention. Okay. Will this session be uploaded on Nursing Manthra account later and we will able to watch it again? Yes, Sheba, we will upload it. Okay, you can watch the initial whatever we have discussed, all the details will be there. You can watch it, no problem. 10 more minutes are there for us. So if any of you have some queries, you can ask. My wife is a diploma nurse and completed her data flow, which came positive. After her BSc, she did additional data flow to update her education as a BSc, and the report came as discrepancy. What is the issue, Chapman? Actually, the BSc degree, whether you have done the regular course or not, is the certificate is fake details, you can just contact Nursing Manthra WhatsApp, which is given here, and just share the passport copy and the data flow report which came negative. Okay, that report you can just share and send your BSc degree certificate also. I will go through the thing, and if any possibility, let me check. Okay. Sometimes if we are not submitting the documents at the proper time also, it can be a problem. Okay. So just inform your friends, relatives, or anyone, those who are facing issue with any data flow, or those who want to do the data flow, you can inform Nursing Manthra platform, and if just to give the details. Okay. So once again, I am requesting you to go with our nursingmanthra.com website. In that, service details are there, which all are the services we are doing. All the details have mentioned regarding the study materials, details mentioned, English class videos just given for watching. I have given so many videos also. You can just watch all those things. Then so many blogs are there for all European countries. What are the processing? For Canada, what is the process? For Australia, what is the process? New Zealand processing, or American, each board separately, what is the exact process we have to do as an internationally educated nurses? Everything have mentioned. So if you are trying to go abroad, any European countries or any different Gulf countries, or how to transfer your reports to another country, all the details have mentioned in the blog also. So if any doubt or if you need any assistance, you can contact Nursing Manthra at any time. You can just message in WhatsApp. That's enough. Once we change passport, then data flow issue will clear, madam. No dear, once we change our data passport, we cannot clear the data flow. As I discussed before, like what are the our name in the document, that is in the education document, our name will be saved in the system. I think maybe they are saving with some registration number or something. I am not sure regarding that, but I hope like that they are easily tracing out the old reports. Even the 10 times you change a passport also, they can easily trace it out, because you are submitting again the same degree which is already verified. When they are verifying any details, that all details will be saved in the data flow system. You can imagine that one. Okay, so you studied in Rajiv Gandhi University, education you have studied. Okay, that degree certificate initially you submitted, that time that degree certificate register number, details, your name or your course name, everything will be mentioned in the data flow portal. Okay, next time you are changing the passport and continuously you are applying again with the new document. Okay, suppose it is employment certificate, you are doing it. That time what will happen? When you are applying with the same education document, you are giving again here also. That time data flow team can easily understand, okay, this certificate already it is verified. Okay, this time with this data flow case number it is already verified, like that easily they can trace it out. Otherwise you must submit the different degree something. Okay, with the same degree it will be possible, right? They can easily identify that. We can imagine. So it is not possible. If you are changing password also, your negative report will get attached. Okay, I complete past 4 months I did not work. Now I joined I in work 8. I work means I got a certificate and then apply for Dubai. Vijay Dravid, just contact me in Nursing Manthra WhatsApp, send all your documents. I will go through the documents and I will just see what we can do. Okay, I'm not clearing it out what is the exact issue happening there. So anyway, just send me in WhatsApp details. My sister also completed the CNA and completed her data flow but did not get exam approval. CNA means a certified nursing assistant that is not approved by any of the authorities. Only with the CNA certificate as a healthcare assistant and all, she can work in UK and all. But in Gulf countries, CNA certificate it is not valid. Okay, actually it is not valid. So many organizations are there in UAE itself. They are doing the CNA training. I don't know for what purpose. and they are not informing to the candidate that they cannot do the registration in the licensing authorities. The candidates will waste a lot of money for the data flow and all the things. After that they will come to know that they are not eligible for the exam. Okay, I will say for the nursing at least 18 months course is required. Okay, that means the assistant nurse category to receive 18 months course related to the nursing. If it is there, then only the basic level they will receive the eligibility. That is assistant nurse. Registered nurse means a bachelor degree, 3 years minimum course must be there. So CNA means only studying for 6 months. That is not only for few content in the nursing they are studying, and nobody will allow them to work in the hospitals because it is patient safety, they have to take care. Okay, that's why CNA, if you are completing, you are not eligible for the assistant nurse or registered nurse category. Okay, you must have the bachelor degree or diploma certificates more than 18 months duration. I hope you understood. Okay, that's why they are not giving exam approval. CNA candidates, they can just be a bedside nurse or assistant, like assistant in the sense certified nursing assistant, like that, bedside nurse, like that, they will get the job posted. Hi madam, I sent a message in WhatsApp but no reply. Yes, we will give a reply. Okay, no need to worry. Actually, our team will collaborate because there are lot of replies will be there. So each reply they will provide. Once we reach to your reply, then we will provide. Okay, don't worry. We today itself we will try to sort out all the replies. Okay, no need to worry. So our staff will respond to you. Okay, don't worry regarding that. So if you have any issues related to the data flow or any other document clearance assistance, if you need, you can just contact Nursing Manthra WhatsApp number. So soon our live session will get ended, 2 minutes. If you have any doubts related to any matter in the healthcare profession, you can just message here. Okay. It is possible to start data flow through an employer with an authentication letter without a UA pass. Actually, this is Dubai talks. Here, I want to mention that UA pass, for which authority you need to do? For the MOH, they must ask the UA pass. First we have to do the MOH registration, then only after uploading the documents, then only we are getting the data flow link. For the HAAD, it is possible, okay, through the employer. If we are giving authentication letter, they can do it. Under the facility sponsorship, they can do it like that, in that way. If you are not authorized in the UA pass also, if you are giving other authentication letter, then they can proceed, no problem. I think you are asking for that. I hope I have completed all your queries, and there is nothing is pending. PSC MLT, yes, I completed. Okay, so it's 3 o'clock. We are binding it. Okay, Parkavi, hi mom, hi dear. Just we will save this video in our YouTube channel. You can watch, and if you have any friends or anyone, those who are in trouble, you can ask them to contact us through Nursing Manthra WhatsApp. Bye bye. Next week Saturday 2 p.m. we will meet again. Thank you. Bye.